Hi there, this is Trauma and Stressor Related Disorders. Introduction to Trauma and Stressor Related Disorders. Trauma is a complex and rarely presents predictably. Clients often carry histories of various abuses or neglect, or not immediately recognizing their ongoing impact. Instead of direct discussion, presentations may include emotional numbing, anxiety, depression, or substance use. All of these things require careful assessment and an integrative treatment approach. The DSM-5 definition and diagnostic category. The DSM-5 defines trauma and stressor-related disorders as conditions where exposure to a traumatic or stressful event is central to diagnosis. This category includes post-traumatic stress disorder, acute stress disorder, adjustment disorders, reactive attachment disorder, and disinhibited social engagement disorder. Common symptoms include intrusive memories, avoidance behaviors, emotional numbing, negative mood changes, and increased arousal and reactivity. The DSM-5 offers a structured framework and shared language for clinicians. There are external responses and internal responses. The external responses can be any number of things, but some individuals do express trauma through anger, irritability, aggression, or risk-taking behavior. Some internalized responses, others internalize trauma, manifesting as anxiety, depression, withdrawal, shame, or substance use. I think that should have said substance abuse. Some of the limitations of the DSM-5, from my point of view, are that their definition struggles to fully capture the complexity of co-occurring conditions. By that I mean there can sometimes be symptoms that are shown that could lead a clinician to diagnose trauma or one of its related diagnoses that is actually two separate symptoms that are from other conditions. So there can be overlap or confusion there. Clients rarely fit perfectly into single diagnostic categories. There could be a whole slew of categories that one person could fit into, and they could present in many different ways just based on the symptoms or what they're displaying behaviorally from their trauma. Misidentifying symptoms can lead to incomplete or ineffective care. If we're labeling a symptom as a part of the trauma when it's really not, and we're trying to treat the client, it can cause problems with their treatment plan because we'll be working on a different area and not actually addressing the trauma directly or at all, possibly. Clinicians must look beyond symptoms to understand the full client context. I just think that the DSM-5 doesn't take into account the client themselves. Some other treatment challenges are avoidance and resistance. Avoidance is a common barrier in trauma treatment, as individuals may minimize experiences or struggle to trust. Clients might appear guarded, emotionally shut down, or resistant to discussing difficult memories, which are often the root of their symptoms. A key part of therapy involves helping clients shift from avoidance to safe, sustainable engagement. Some of the evidence-based clinical interventions, cognitive behavioral therapy. This is the idea of catch it, check it, change it. It helps clients challenge distorted thoughts related to trauma and self-perception. Grounding techniques such as identifying different things that you can sense with your five senses in the specific room, allowing you to remain more present. The grounding techniques, strategies to regulate emotional distress and remain present during difficult moments. Motivational interviewing improves treatment engagement, especially for ambivalent or hesitant clients. This can be simplified by saying it's the use of open-ended questions to explore more fully and help the client open up. And group therapy, which is incredibly effective, helps reduce isolation by helping clients recognize that they're not alone in their experience. This can also strengthen the client's willingness to participate or allow them to know that it's safe to actually share some of the things that they've been through. Integrative and relational care. Trauma impacts identity, meaning, self-worth, relationships, and worldview, making clinical techniques alone insufficient. Rational consistency, showing up reliably, being honest, and creating emotional safety is crucial. Reframing trauma as something enduring and survived, rather than defining fostering healing, resilience, and growth. Just to kind of integrate a little bit of a Christian worldview and trauma. Trauma, understood within the reality of a broken world, is the idea that we have a sin nature. All humans are made in the image of God, and are then hurt or made sick by the sin nature of our world. Suffering is not necessarily a personal failure. Trauma does not ultimately define a person's identity. This means that what has happened to you doesn't make you who you are. We can choose how past events can frame us and form us. Christian themes like restoration, redemption, healing, and forgiveness offer hope and meaning. This is a great one to talk about grace, great place to talk about grace, self-forgiveness, forgiving others, forgiving people who have hurt you, and allowing yourself to move through some of the trauma. It also supports movement from shame toward healing and personal growth for appropriate clients. I think that's pretty self-explanatory. The clinical implications for counselors. Clinicians must remain flexible, patient, non-judgmental, and relationally consistent. People who have experienced trauma want to know you're there and you're not going to hurt them. You are a safe person. We need to be able to recognize resistance, avoidance, or anger as protective responses, not non-compliance. Effective treatment involves an accurate assessment and safe therapeutic relationship. We need to utilize evidence-based interventions and address meaning and identity. Healing from trauma is gradual, non-linear, and it requires skill and relational presence. So to wrap it all up, trauma and stress-related disorders are complex. They require more than symptom identification. Clients often present with overlapping disorders, trust issues, and emotional avoidance. Effective treatment combines evidence-based interventions, relational consistency, and emotional safety. The focus on identity and meaning to move individuals toward healing, growth, and restoration, that needs to be the main point of therapy, or should be. Thank you very much.